Hello, this is 10-Minute Tips for Maximum Health, and today I'm talking with Dr. Thaddeus Gala. Dr. Gala and his team help clients reverse chronic health issues in 1 to 8 months while concurrently reducing or completely eliminating all prescription medications. He's helped over 2,500 clients, including published research on reversing endocrine disorders. He's been featured on NBC, CBS, and is asked as the keynote speaker at hospitals and medical teaching facilities. He has sought for third-party peer reviewing of medical research prior to publication, and he is the founder and medical director of Complete Care. Dr. Gala is on 0 medications and is a top 25% Ironman finisher. With that said, Dr. Gala, welcome to 10-Minute Tips for Maximum Health and Wellness.
Well, thank you, Brad. It's great. I'm glad to be here, and hopefully we can share some good information with your listeners.
Yeah, I agree. And it's always fun to speak with somebody with your level of experience and really drill down what the most important things that people can be doing for maximum health and wellness. So that being said, what is the number one thing you recommend for exactly that, maximum health and wellness?
The number one thing that I recommend for maximum health and wellness to my patients and people in general is a very specific lab test. And this one lab test has been shown to actually be a predictor of future chronic disease, aging process, weight gain, Alzheimer's, diabetes, etc. So there's one specific lab test, and it's been around for I'd say about 12 or 15 years. It's really gaining some steam. But this one lab test called HSCRP is one of the best predictors of future health, and monitoring that can really set you up for years to come and having a healthy, high-quality life.
HSCRP. Okay, that's interesting. What can you tell me about that? What does it do? What kind of test is it? And what results does it give you in order to help
Sure.
predict and diagnose?
Well, HSCRP, and there's a difference. So for those of you listening, you want to make sure that it's HSCRP, not just regular CRP. So HSCRP stands for highly sensitive C-reactive protein, and it measures your body's inflammation. Now, most of us think of inflammation like when we sprain our ankle and it swells up, but that's acute inflammation. What HSCRP tests is your subclinical or your baseline inflammation. And this baseline inflammation we now know is one of the main drivers of chronic disease, chronic pain, autoimmune issues, heart disease, cancer, etc. And people with the lowest inflammation for the longest time have the best health outcomes over long term. It's a simple blood test. It's typically anywhere, depending on your region, anywhere from $20 to $75, depending on your state and city. It's a simple blood test. You don't have to be fasting. You go in, you can have it done. And research actually shows that having, well, two things. Number one, we know now that cholesterol, normal cholesterol, really isn't that best of an indicator for health, because we know half of all heart attacks occur in people with normal cholesterol. And this was discovered for the inflammation link, because we know now that having low cholesterol but high inflammation is actually much worse for your health than having high cholesterol and low inflammation. And I apologize if I just said that backwards, but the overall being that we know cholesterol isn't that best predictor for heart disease, and we know that having high inflammation is a much better predictor of future cardiovascular events, as well as overall morbidities and mortality. So we know that getting your inflammation down is really the best indicator. Now, the next question people typically have is, well, where does inflammation come from? Well, it comes from a lot of things, and typically all the things that we know are healthy, but it's a great tool so you can really assess where you're at in your health continuum and which direction you're going. So some of the common things that cause inflammation would be, of course, the big ones and the obvious ones would be smoking, not exercising, and a diet full of junk. So, of course, the things to reverse and reduce inflammation there's specific supplements that will help with that, such as fish oil, vitamin D. There's a handful of other ones, as well as we know that specific foods can increase inflammation. Some of the biggest inflammatory foods would be cutting back and reducing the grains, seeds, legumes, lentils, beans, and dairy products. Those are typically the big ones, as well as refined vegetable oils. So those would be the big ones that I typically recommend that people start cutting back on their diet, and you can typically monitor that with the HSCRP test.
Yeah, that is really fascinating, and a lot of that is, counterintuitive to what a lot of people have been taught over the years. Telling folks that grains are good, get your healthy dose of grains and beans and whatnot, and all of these quote heart healthy vegetable oils like canola oils and all of these other types, which I've heard can actually increase the inflammation. But you're saying that this is counter to typical published health
Oh,
knowledge.
absolutely. And we know that about 72% of our calories in America contribute to inflammation, meaning that 72% of what people put in their mouths leads to inflammation and leads to the chronic disease process. I mean, I had a client that was following through with one of our coaching programs, and she was doing some of this in lifestyle modifications and some of these changes, and she'd been doing it for about a month, and she went from barely being able to walk because she had so much chronic pain and so much inflammation, and within 1 month, she not only lost 11 pounds, but she was already back to dancing, not just walking, but dancing. And this was a lady that had been for months that she had been extremely difficult for her to walk. I remember when she first came into my office, she had difficulty getting up and out of the chair during her consultation. And she saw me just the other day. She actually grabbed my hand, and she actually kissed my hand and said, "Thank you for giving me my life back." And it's wonderful to see that, and it can happen that fast when people start cutting out the inflammatory foods, toxins, the mental stress. All these things that we know cause inflammation. When you start getting that down, you can see some dramatic results in anywhere from a couple weeks to a couple months, and that's how we're able to help people get off their blood pressure, diabetic medications, their chronic pain, fibromyalgia, headaches, etc.
Yeah, that really is remarkable, and I can't imagine the feeling that gives you when somebody thanks you for giving their life back. That is, it probably makes all the hard work you've done really worth it. What are some of the biggest stumbling blocks that people have when trying to uh, have a lifestyle that decreases inflammation? Is there anything people need to be aware of?
Yeah, the biggest stumbling block that I see is that people is a couple things. And number one, that would be that people think they have to do all or none. And what happens is people think they have to do all or none, and when they slip up or they go backwards, they feel like they have to throw in the towel, and they just say, "Oh well, I can't do any of it, so I'm not going to do, or I can't do some of it, so I'm not going to do any of it." And actually, just yesterday, I had a follow up with a patient. She went to Hawaii for a week, and when she came back and she had her follow up appointment, she said, "It was really powerful because I was doing so well, and I was in Hawaii, and I deviated, and I started getting some more inflammatory foods, and even within that week." I started noticing more subtle swelling. Some of my chronic pain started coming back. I started gaining weight subtly, but it was enough where she came back, she cleaned up her diet, she started making a few changes, and she was right back to feeling great again. So I'd say the biggest stumbling block is people think that they have to do all or none. So I would really encourage people to focus on making the few strides and improvements that you can, and starting with that and feel good about those successes. Start seeing some improvements, start seeing the weight loss, the energy improvements, so you can start having a normal life again, and feel good about those changes, and realize that change is a process. It's not an event. That would be the biggest one. And the second one I would see is that people tend to minimize their health or what they're actually doing. And I see a lot of people think, "Oh well, I'm pretty healthy," and they minimize it because they really don't want to make some changes or really admit that they have some areas for improvement. And what that does is mentally it sabotages them, and they stay on medications, they stay sick. So I would say those two things. One is realizing that, yeah, it is going to take some changes. And secondly, it doesn't have to be a lot of changes to start seeing improvements.
Well, Dr. Gala, this has been really, really informative, and I think a lot of people neglect taking care of, their health and neglect looking at, inflammation as the main source of a lot of these problems. So thank you for sharing this, as well as the lab test you said that folks could get, and that was the HSCRP. Is that correct?
Correct. HSCRP, and that really is the driver now. Now, HSCRP is one of a lot of inflammatory tests, but it's one of the best ones we have. So yes, understanding the inflammation concept, absolutely.
That's great. Now, where can people get more information from you if they'd like to reach out and contact you?
Oh, sure. If people want more information, they can go to drthadgala.com. That's drthadgala.com. There's actually an inflammatory test on there to figure out if you're inflamed or not. There's a lot of interviews from other experts and downloads and free resources people can check out and start on their journey towards an anti-inflammatory, healthy, low weight, or healthy weight, high energy life. A lot of that information's on there.